Happy Wednesday, everyone. Glad to have you here. And I have a question for you. Do you want to avoid this? Hey, if your doctor is telling you that you need spinal surgery, spinal fusions, microdiscectomies, or anything along this line, and you want to avoid having rods, screws, bolts, and scars like these people do, you're at the right place today, because that's what we're going to be talking about, and I'm going to show you how to do it. So I want to welcome each and every one of you. It's great to have you here with Back Talks. And if you're with us, please say hello. Would love to say hello to you. And also, if you have a question while we're doing our live today, I would love to answer that for you and bring some hope and inspiration into your life and help you realize perhaps that there are non-surgical approaches that work absolutely amazingly well when they're done correctly, using the right protocols with people that have the education and knowledge and experience to do it for you. So I don't want you having to live your life looking like this. I see this all the time on Facebook. It breaks my heart seeing surgeons. I just had lunch with a person who works and sells surgical devices, and it was unbelievable to hear what she was telling me on how gross it is on these doctors being so highly incentivized to do more and more surgeries. Most of them don't care about you. I'm just going to let you know that. They want to practice. They want to be able to do more implants on you because that's where they make all their money at. Hospitals incentivize them to come and work for them, especially the ones that are doing a lot of surgeries, because they know that if you're doing surgeries, their ORs are full and they're making money too, and it really is a business. And I don't want you to be like the people that I just showed you. So are there other alternatives? Are there non-surgical options that you can use to manage bulging discs and herniated discs, even if they're bad? Facet arthropathy and spinal stenosis? Well, the answer is absolutely yes. And I'm going to show you that here in a second. So I want to make sure that you guys can get on with me. All right. So hey, sometimes when people, when I'm on Facebook and YouTube, and then you send me a message, if you do it on Facebook, it doesn't always come up. The technology is not perfect, so I have my phone with me as well. So if I'm going to show you want to say hello, if you have a question for me, and I can't see it on my machine, I'll look at my phone. So make sure that you say hi. I want to bring more light into your life and give you some guidance from a non-surgical expert who's been doing this for almost 30 years of his life. So let's talk about it. Do you have other options? Are there other options available? Well, yes, and I want to make sure that you understand that, it's one thing for a person that has a bulging disc or hernia disc or spinal stenosis who are having low back pain or neck pain, radiation down into their shoulders, arms, hands, or fingers, or down into their buttocks, legs, and feet. Having weakness to think that surgery is their only option. But I want you to know that I'm going to show you not just proof of their symptom relief and resolution, but I'm going to show you pre-MRI and post-MRI after 12 weeks of going through our proprietary protocol that I developed and designed based off of a lot of research and a lot of experience. And I'd like to show you a couple of those right now so that you know that your body can heal on its own when you take the right approach to it in over 80% of the cases. All right. So, hey, Marisa, great to have you here. Sorry, just looking. Oh, okay, there it just popped up. All right, very interesting. Sorry, I use a piece of hardware to let me see everybody's messages and stuff, and sometimes Facebook and YouTube and Instagram doesn't always want to play friendly with it. So, but I can see you now on my screen. So welcome, welcome. Great to have you here. Okay, let's get on with it. Let me show you this. So let me show you this first person. So this person, when they came to see me, pre-decompression, severe low back pain, sciatic pain. If you don't know what that is, that's pain that goes down your buttock, legs, or foot. Not what you want. Can be very painful, very debilitating. weakness in their legs, constipation. Why? Well, because the nerves that go down to your low back also go to your large intestines, your reproductive organs, your urinary bladder, prostate gland, and all those parts down there. So it's the same exact nerves. So if it's getting compressed, you can get organ malfunction as well. Could not travel or be an active dad. Let's look at this person's MRI. And this is one of my patients. So if you're familiar with bulging and herniated discs and MRIs, you probably know this side image right here. Massive disc herniation. Pushing into his thecal sac, you can actually see how it's indenting. You can see that black line right there. It's not supposed to be doing that at all. Okay. Here, you can see on his, it's called the axial view. This is when, if we get cut in half and look up inside your body, this is what we'd be looking at. Again, here's the disc. And if you know anything about discs, the back of the disc right here should be in an arch. So your belly button would be up here, and this is actually the skin on your back right there. You can see this big massive blob of material. That's that herniated disc of theirs, totally compressing the nerve branch. This green MRI that you see right here is the same person 12 weeks later after going through our proprietary protocols, non-surgical protocols, no low back pain, disc rehydration. That means the disc is actually getting more blood supply, more oxygen, more nutrition into the disc as well. Running multiple businesses, no more sciatic pain, normal bowel function, running multiple businesses again, locations, and being the active dad that he wanted to be. And I want you to look at the difference. Almost no compression right there, and a probably 95% retraction of the disc right there. You can't even get that stuff surgically, people. I've sat in and I've seen a lot of pre and post operations on herniated discs and surgeries, and they don't even look that good. So, all right, there's one case. Yeah, anybody can get that. How about this one? Let's go take a look at another success story, non-surgical success story. This is pre-decompression, severe sciatic pain, severe muscle weakness in his legs, diminished lumbar reflexes, severe low back pain, and could barely sit and perform his job. Once again, here you can see this herniation, big herniation right there. It's not supposed to be there. Again, if you know what you're looking at, this big black area right here is all the jelly that was sitting, supposed to be inside the disc right here, that has fully squirted out, totally compressing his nerve and compressing his thecal sac. That's the covering around the brain and spinal cord. 12 weeks following our protocols, no sciatic pain, normal reflexes, no muscle weakness, minimal low back pain, able to perform his duties at work and be an active husband. And look at the difference. Almost full retraction of the disc. You can barely even tell that he had a herniation. Remember, this whole big black blob was all the way right there. This is what you can do. And believe it or not, you can do this from the comfort of your home in most cases. Let me show you another success story of another patient of ours. Again, pre-decompression, severe low back pain, was told by 4 surgeons that he needed surgery, sciatic pain down to the foot, leg weakness, and could not move. And let's take a look at him. Massive disc herniation again here. All this black stuff, do you see that? That's all the nuclear material that's supposed to be sitting in the middle of this disc right here has all come out and totally compressed part of his thecal sac and his nerve branch going down his left leg. This guy came to me from the emergency room on a Saturday morning. My phone rang from his wife saying, "Is there any way you think you can see my husband? He's in severe back pain." And look at the difference. This is 12 weeks later, following our protocol. Very, very slight herniation at that point. Okay, but I mean, look where he started at. And again, probably over a 50% reduction. The main thing I want you to know, though, is when we did this, is that this guy had no low back pain after 12 weeks, no sciatic pain anymore, no muscle weakness, back to an active life. Now he hikes. He's a dad now, and is doing amazing. And can you imagine if he would have followed those 4 surgeons' recommendations? He'd probably still be in pain right now, maybe even worse than trying to be a dad. And I don't want that happening to you if you're a mom or if you're a dad. So I want to show you one more because I want you to realize this stuff is possible. This is a gentleman, and he was a big boy too. This guy was probably over 300 pounds, pre-decompression, severe low back pain, left leg pain, sciatic pain, muscle weakness, abnormal S1 reflexes. And I guarantee you, if you go onto the Facebook groups, you're going to see some stuff like this. And this doesn't even really all look that bad in here for the most part. But when you come over to this axial view, you'll see that right here, the distance between this black piece and this black piece right there is supposed to be at least 5 millimeters. Here you can see there's nothing. And that is his nerve on his left side going down his left leg, totally compressed by a herniated disc. Let's look at him 12 weeks later. Almost a perfectly normal discs in the back. And the other thing I want you to see right here, and so this is a great picture. If you look right here to there, this distance, ladies and gentlemen, is how thick the spinal nerve branch should be coming off your spinal cord. And you can see again where there was zero space for him. Again, look at all this space now for him. How is he doing? Post-decompression 12 weeks later, no low back pain, no sciatica, no muscle weakness, normal S1 reflexes, and back to an active life, and did all of that without surgery. And you can too. I hope this has brought some inspiration into your life. I hope that if this is you, that you'll give us the opportunity to help you and guide you before you get surgery. Because remember, if you get a surgeon that goes and wants to do spinal fusion on you, and they're doing more and more of that, I just want you to know. And if you don't believe me, go on to some of the herniated and bulging disc groups on Facebook and go look at what people are posting, and you're going to see more big scars in their back, more hardware, more screws, more bolts. And why is that happening? Because anytime a doctor puts a screw or a bolt or a rod in your spine, it is a massive payday for them compared to just going in and doing a fusion or doing even less than that. So these guys are over surgically doing more surgery. I'm trying to get the right words out for you here. They are performing way more extensive surgeries than need to be done because these surgical places are creating more and more artificial discs and rods. And these guys know that every time they put one of those in, it's another $25,000 to $50,000 on top of your bill. And they get paid off of that. And so do the hospitals and their clinics. And you, unfortunately, get to be the recipient of not only an astronomical surgical bill, but hardware that is probably going to dramatically limit your ability to have a normal life for the rest of your life, and scar tissue that goes around it because someone wanted to do and make a bigger paycheck. Now, just realize I'm not against all surgeries whatsoever. If you've been with me for a long time, you know that. But I just had a meeting with a person a month ago, and she sold surgical equipment to doctors, and she said it was disgusting and toxic what was happening in the surgical rooms, and she sees it every day, and I don't want you to be one of those victims. So if that's the case, I want to offer you something today. I would like for you, if you want some guidance, if you have someone in your life, if you're a mom and you can't be the mom that you want to be, I want to give you an opportunity to talk to me and let me know what you've been through. If you have imaging, I'd love to give you a second opinion on that. And just see if there is a non-surgical approach for you that could help you avoid having to get all that stuff done and big scars down your back where you're recuperating for months and months, or maybe even worse. And if you don't believe me, go onto some of these Facebook groups. You're going to see a lot of people, they're worse than what they were, and I don't want that happening to you. I want you to do it naturally, and you have an 80% opportunity to do that. And I'm just letting you know that because that's what the research shows. In my clinic, it was 93%. That was our success rate. And I do post MRIs because I don't want you to just go off of how you're feeling, but I want to show you objectively and scientifically that we can get your discs in your spine to be healthier without surgery, and surgery can't do that for you. It never will be able to do that for you, but you can heal on your own with a very high success rate. So if you know someone that's suffering like this, I hope that you'll share this video with them, and I hope that you'll share this link, because this is a link to set up a call with me. You can set up a Zoom call with me for about 20 minutes. I'll send you a form as part of that. You'll fill out and let me know everything you've been through, what you've been suffering with, what type of imaging you've had done, what's been your diagnosis, and then you and I can talk about it, and I'll give you a second opinion on it. If I think that there's a non-surgical approach for you, and I think that Disc University, the course that I created to help people all around the world be able to do this from the comfort of their home, would be a good fit for you, I'd love to share that with you as well. So if you are suffering with this and you are looking for a non-surgical approach, or someone in your life that you love is, please go to booking.drshawnmcwilliams.com. You'll get see my calendar of when I have some openings. There'll be a form that you can fill out. Just submit that, and you and I will have a Zoom call, and I'll give you a second opinion on your images and see if we can help you do this non-surgically. And I want you to remember, in most of the cases, the answer is yes. So it's great to have you here. Marisa, always great to have you here. Does anybody have any questions for me while you still have me live? You know, we had a great question last time, is that can you do spinal decompression if someone's had surgery? So I'm going to answer that for you today because it was a fabulous question. And the answer is, in most cases, yes. If someone had a microdiscectomy, if someone had a laminectomy, you can do those. We usually have to wait 6 months until the healing is complete for those, and then you can do spinal decompression. If there is hardware, though, in the spine that's any sort of screw, bolt, artificial disc, plate, cage, or anything like that, you cannot do spinal decompression. So in your decision-making process, if you're being told that you need one of those, get on a call with me so I can help give you some guidance. And if I think that you need to have that done, I'll tell you that you need to have it done. But if I think that you may have success in being able to manage this from home, doing spinal decompression from the comfort of your home, I will also share that with you, and I'd love to share you the course that we created. We've worked really hard on it. It's taken us almost 2 years to create it. We have people all over the world having great successes with it, all the way from Indonesia to Hawaii, throughout the United States, and I would love for you to be next. So we would love to help you. So if you want to get on and talk with me, you want to go to booking.drshawnmcwilliams.com. I hope you have an amazing day today. I hope you feel like I've added some value to your life. If I did, please subscribe to our channel. Make sure you hit the bell for notifications. That way, every time we do this every week, you'll be one of the first to know. And you can leave me some comments. But if you'd like to talk, make sure you go to that site. All right. Great to have everybody here. And we look forward to being with you next week. Facebook and YouTube at 1 o'clock and Instagram at 12:30. So come join us. Missed a great one on Instagram today. If you weren't with us, had a great doc from Tucson, Arizona. Super human being as well. So it was really cool. And we try to make these fun and lively and add value to your life at the end of the day and give you hope. So hope you have an amazing day. See you guys next week. And Marisa, you are so welcome.